Hey, med school made easy. Today we're going to talk about organisms that produce urease, an enzyme that breaks down urea into ammonia and carbon dioxide. It's pathognomonic for certain organisms in certain parts of your body, and there's a mnemonic to help remember which ones those are. The mnemonic is punch. Okay. The P stands for Proteus, like Proteus mirabilis. We'll talk about in a second why that's clinically significant. Used for urea plasma, which isn't very common clinically. The N is for nocardia. C is for cryptococcus fungus. And the H is for Helicobacter pylori, which is probably the most popular one out of this bunch. That's punch, that's the mnemonic. There are other ones that are less clinically significant in terms of urease, staph, and Klebsiella and things, but in any case, so Proteus is important because Proteus is the most common cause of infection-caused urinary stones. So these aren't your calcium stones that are radiopaque. These are radiolucent struvite stones that can be seen, in your renal pelvis and things, and be quite symptomatic for people. And it's because you have an infection by Proteus. Proteus makes urease, and urease increases your ammonia, because it's a breakdown product, turns urea into carbon dioxide and ammonia. Carbon dioxide isn't a big deal. Our body's really good at dealing with carbon dioxide, but ammonia can be a big deal. So if you have an increase in ammonia, it increases your risk of forming these struvite stones. The other clinically relevant one of these five that I want to talk about is H. pylori, Helicobacter. This causes the vast majority of peptic ulcer disease, like a bleeding duodenal ulcer and things. So most people who have that are treated for H. pylori to eradicate this bug. What happens is, you increase ammonia, that decreases your mucosal protection, and that causes ulcers. Another thing is H. pylori. If you have that in a cirrhotic and you have too much ammonia, those patients get encephalopathic, so it can be really bad in a cirrhotic. They'll get treated for H. pylori. Another clinical tidbit is one of the ways to test for H. pylori is a urease breath test. And so you can have these patients perform a urease breath test in a lab, and that can quickly say, hey, there's the presence of urease in your foregut, and you just breathed it out, and we can treat you for it now. The gold standard would probably still be a biopsy, maybe a stool antigen test, but still, a lot of people are performing a urease breath test. It might be less invasive, more comfortable. So that's the mnemonic for urease-producing organisms, punch, and Proteus and H. pylori are the two ones to remember because of that increase in ammonia. Thanks.